Dear colleagues and the global spine opinion leaders, I am Dr. Naresh Babu from India. I am the principal investigator for the AO spine adult spinal deformity classification. So we all know the AO spine Asia Pacific has proposed a new classification for adult spinal deformity. Combined with the AO Spine Knowledge Forum, we are in process of developing a new classification which can comprehensively classify the adult spinal deformity into different categories. The goals of management of adolescent spinal deformity completely differs from that of adult spinal deformity. In adolescent spinal deformity, what we are aiming is to prevent the progression of the curve, and our classification should be able to identify the structural causes which will really influence the treatment philosophies. But in the case of adult spinal deformity, it's not only the radiological deformity but also the clinical factors like low back pain, the leg pain, the neurological deficit, the claudication of the patient, the functional status of the patient, and sometimes the comorbids, which really matters while you are dealing with these patients. When you are decided to operate on these patients, we need to know the comorbid factors. Unless we consider these three domains, the clinical domain, the radiological domain, and the comorbid domain, we cannot really classify this patient comprehensively to suggest a treatment or subcategorize these patients into different domains. We have done some preliminary work basing on the data obtained from COSCO study, which is a combined study between the Scoliosis Research Society and the AO Spine Knowledge Forum Deformity. We have enlisted the factors which really matters in dealing with these patients of adult spinal deformity. As you are the global opinion leaders with vast experience in the adult spinal deformity management, we wish your expertise to be brought into the classification system. You can do that by accepting our request to be one of the expert panelists in the Delphi process. With your valid inputs and suggestions, we are hopeful to develop a AO spine comprehensive classification system for adult spinal deformity, and it will be able to guide the clinicians in classifying the adult spinal deformity patients into different subcategories. I once again request you to take part in this Delphi process as expert panelists and guide us in developing a comprehensive classification system for adult spinal deformity. Thank you very much.